I am Bernard Herschel. Before my retirement, I was the chief of HIV/AIDS at the Geneva University Hospitals. You may call me an AIDS dinosaur who has followed the HIV epidemic from the very first cases in the early 1980s through the triumph of antiretroviral therapies, a triumph unequaled in the annals of medicine. This triumph has its flip side. Younger colleagues are no longer familiar with the opportunistic diseases and the myriad manifestations, hence the idea of these videos. After a short introduction, they will show a series of images illustrating one or several exemplary cases from my files. Kaposi sarcoma KS, presentation outline. Typical appearance of KS on white and black skin. Lesions of the oral cavity, large lesions with local complications. In a second video, I'll talk about visceral KS, the effect of treatment, and histology, and the human herpes virus 8, HHV8. Lesions of KS are typically multiple, of purple color, dark pink to dark blue, a macule, later a papule or nodule, with washed out borders. The preferred locations are arms and legs, the oral cavity, the tips of the nose and penis, but they can occur anywhere on the body. Kaposi's sarcoma with typical dark purple multiple macules below the right knee. Kaposi's sarcoma, note the color and the washed out margins. On the right, a slightly elevated lesion between a plaque and a papule. The tip of the nose and of the penis are typical locations for KS. Eruptive KS is when multiple simultaneous lesions occur, as shown here. This is, of course, a strange behavior for a tumor and suggested that an infection might be the cause of KS. Unusual locations of KS. From top left, eyelid, conjunctiva, lip. Note the concomitant candidiasis and perlesh, and ear. On black skin, the lesions are similar, but more difficult to see and to distinguish from irregular pigmentation. A majority of patients with skin lesions of KS also have involvement of the oral cavity. These lesions almost always involve the palate, but can occur anywhere else in the oral cavity. Extension to the rest of the digestive tract is also possible. They start as violet, asymptomatic macules, which become more numerous and start to grow. Further extension is seen here, with macules slowly becoming plaques. The lesions become tumoral, and can become monstrous and ulcerated, interfering with eating and swallowing. The next series of images shows the same evolution on the gums. Here the macular stage. On the left, a mixed lesion with macules on the gingiva, but with a tumoral lesion of the interdentary papilla. On the right, two gingival tumors. Two examples of large gingival tumors of KS. 3 examples of KS of the tongue. KS can occur anywhere in the oral cavity. Here are 2 examples of more difficult to detect lesions. Lesions of KS can become very large and cause local complications, in particular edema of the legs and foot. Note the marked difference in sizes of the right as compared to the left thigh. The close-up shows the orange peel appearance of the skin, indicative of lymph ducts blocked by KS. This is an MRI scan of the previous patient. Note the difference in size between right and left leg. Same case as previous slide, edema of the right flank. Tumoral lesions of KS. Note the edema on the right. Advanced Kaposi sarcoma with edema of lower extremities and genitals. Another monstrous lesion of KS in an African patient. This concludes the first part of the presentation on Kaposi sarcoma. A companion video will include visceral KS, treatment, and the role of HHV8. Thank you for watching, and thanks in advance for your feedback. I'm indebted to Jackie Sampson and Laurence Toutou-Trelu for the photographs. This video is part of a series on opportunistic diseases in HIV/AIDS. If you are interested, please subscribe or click on the latest upload top left.